Well, let's stay on this story. So for reaction, we have reached Dr. John Granton in Toronto. He's the Medical Director of Health Services at University Health Network, and he joins us now live. So Dr. Granton, thanks so much for making the time.
Pleasure. Thanks for asking me to participate.
Yeah, absolutely. So we want to get right to it. What do you make of this new policy? It is designed to keep staffing levels stable, but what do you make of all of this?
Well, I think, it is in response to a concern of being able to provide timely care to patients during periods where we face a crisis in healthcare workers. And it really is for all healthcare workers, physicians, nurses, respiratory therapists, everybody, house cleaning staff, everybody in the organization. We're all integral to making sure that we can effectively deliver care. And it's always a balance of risks. And I think, the risk of not being able to deliver timely care to a patient who's in need, and even the risk to our existing workers who are increasingly being stretched. And if there's more absenteeism, they're going to be asked to work more shifts, longer hours, looking after more patients, which is also a safety concern for both patients and our healthcare workers who are already burning out. So I think you have to land on a strategy that's realistic and one that is considerate of risks and tries its very best to minimize overall risk for the healthcare system. So I think each hospital needs to evaluate its own needs. And I can tell you we're contemplating this as well.
Okay, so talk to me about that.
Yeah.
Talk to me about that you're contemplating it, but it's being considered, but it's not yet implemented for UHN. What sort of decision-making process? Kind of walk us through that decision-making process.
Well, the decision-making process will, again, have to look at our staffing levels and what the need is across the organization. And it may be specific areas that we need to consider this. So I think, when we implement this at some point, if we do, we suspect we will, we'll just have to make sure that we define a really clear process, that we socialize it with our partners across the organization, and that everybody understands the why we're doing this and the what, which is essentially trying our very best to ensure that we keep both our co-workers, my colleagues, safe, and as our patients safe as well. And you heard already how that's going to be accomplished, which is something we're doing already, which is a definitive PCR test and then daily assessment of symptoms, which we ask everybody to do before they come to work to make sure they're not having symptoms. And the symptoms could be very mild here. And then also a rapid antigen test. And then further, at day 7, another PCR test. And I have to also emphasize that, we're not bringing in people who are COVID positive. These are people who are COVID negative, and their risk of acquiring COVID infection is small. So we're not bringing people who continue to live at home with somebody who has an active infection. These are transient exposures, which are really very low risk for transmitting, and that's going to be on a case-by-case basis.
Okay, so you're quite a few protocols then that are going to be in place just to make sure that they are constantly rapidly doing these rapid tests to make sure that that test result does not become positive. So I hear you on all of that. I do want to ask you before you go, though, that, Ontario today reporting more than 4,700 new cases. Of course, we're still waiting to sort of see what this does to the hospitalization levels. How concerned are you about the numbers we're seeing in Ontario, especially when you look, to neighboring Quebec and see what's happening there? How concerned are you right now?
Well, I think I'm very worried, what could happen. We're hopeful with the number of people who are vaccinated and maybe the nature of the virus itself that we'll see less severe infections, which means fewer hospitalizations and fewer ICU visits and less of a strain on the healthcare system. But this, again, I think is a very different wave. And what we're seeing is a lot more people who are becoming ill and as a result not being able to come to work. And that's affecting more than just healthcare. I'm sure it's affecting where you work, people not being able to come in. So I think it's going to be a very different wave, but equally will have its constraints and challenges.
That is for sure. That definitely seems like that is going to be the case, and seems like it'll be a couple more weeks at least until we really sort of get a sense of what this will do to hospitalization levels. Dr. John Granton, thank you so much for your time. We appreciate it.
It's my pleasure. Thank you for the invitation.
Absolutely. You as well, you as well. Dr. John Granton in Toronto. He's the Medical Director of Health Services at University Health Network.